I think one of the things that's very frustrating to me is the perception of medications to help patients that are struggling with alcohol use. So there are a lot of medication options that can really increase the likelihood that someone that has an alcohol use disorder will be able to maintain sobriety over the long term. And unfortunately, those medications are just really underprescribed, and I don't think that there's a good reason for that. When people are familiar with medication to treat alcohol use disorder, the one that they're most commonly familiar with is called Antabuse or disulfiram. That's a medication that makes people really sick when they drink, and while that medication is an option for people, it is not the only option. In fact, there's a whole range of medication options. I wish people had more access to those medications because they work and they're effective and they're safe and they make a big difference in outcomes. And part of what we do when we're talking to people with an alcohol use disorder is really try and figure out, are there medications that would be helpful to decrease the likelihood of relapse or to minimize the severity of relapse, because alcohol use disorder is a really hard thing to have, and it's a hard thing to live with. And the ability to improve someone's chances of having a successful recovery is what we're about and why we come to work, and medications are often a really big part of that.